Just give me
It's all
1
right.
second.
This meeting is being recorded.
There we go.
And I'll admit everybody as well, because people were still in the waiting room.
Don't worry, I'm not exactly on.
Hold on. I knew you'd tell it to me straight. I said, well, don't be listening.
So I think, just to reiterate those two critical messages, there is a lot of respiratory illness around in various forms, including COVID. What we really need to encourage people to do is get the vaccines and stay at home if they're unwell, whatever they're unwell with, really. So happy to take any questions on that. Tracy, if I could, I think we were on about slide 11, weren't we?
Yeah, we're there.
So,
sorry.
Yeah, so we're there. So if I could have slide 11, I think just reinforcing that message, you can see there is a relatively small increase in COVID inpatients in mid-Yorkshire. So we are seeing more COVID, but I think that's very much part of a much bigger picture where we're seeing COVID and a whole lot of other things. And you probably don't need me to lecture you on the pressures that are emergency services and the ambulances, particularly today, are working under at the moment. So I think the only other community message to put out there is for people to seek medical help when they need it, but if we can support self-management and choosing the right service for people who don't need A&E, and if we can encourage people not to be spreading their respiratory germs around, both of those things will help a bit to reduce some of the pressure on the ambulance and the hospitals. So I think that's probably all from me, Tracy. That's the
one last slide.
One last slide, which is again showing that consistent low, but still there, but deaths from COVID. And then I think we're on to any questions. So happy to take any questions either about COVID or about that bigger picture around there being a lot of respiratory illness.
Thank you, Claire. I hope I've stopped sharing that now, because there's people still in
you have no, you have indeed.
Thank you. I'm sorry, I'm trying to multitask and making a hash of it. I can't see if there are any.
Ben's got his hand up.
Right, thank you.
Yeah, I was just going to ask, I've had a few people when mentioning COVID and the vaccines and things like that who've said that they're not going to get them or whatever because of there's a report from one of the providers, was it Pfizer or Moderna or someone, which said they had no evidence of the efficacy of the vaccine and stuff like that. I'm just wondering if there's any sort of general advice for, not that it really comes up in my job, but is there anything that we'd respond to that with, or that we can counter?
Absolutely. I mean, I think this is a misinterpretation. I think people have started to say, not that we know that the vaccines are very effective. They've got three jobs, if you think about it. One is to prevent people getting seriously ill. And actually, if you look at the ICU figures and the deaths figures, they are very, very good at that job. So job number one the vaccines will do is, if you get COVID, they will protect you against being really poorly with it. And that is a consideration even for younger people. When we didn't have the vaccines, we saw that mostly younger people were fine, but not all younger people were fine. and we would have fit people in their 30s who were getting admitted to ICU. So that's the first job they do, which is a very good one. They are less good at preventing you from getting infected at all and in stopping transmission. But I think the thing people get confused about is they have quite a significant impact on how likely you are to catch COVID in the first place. If you get COVID, then the vaccine won't stop you passing it on. And I think that's why people say it doesn't stop transmission. But there is a definite impact on the chance of you getting COVID in the first place. And obviously, if you haven't got COVID, you can't pass it on to anybody. So I think the message I would want to give to people is it's really important in terms of protecting you from serious illness, and that the risk of that will vary depending how vulnerable you are. I acknowledge that, but when we didn't have vaccines, everybody was at risk of serious illness at some level. So it is important there. It will reduce the chance of you getting infected, and if you're not infected, you can't give it to anybody else, and particularly you can't give it to a vulnerable person. So that's why we are still vaccinating household contacts of immunosuppressed people. Because if you think about it, that wouldn't make sense if there was no impact on transmission. We do that because it does reduce the chance of them getting it and passing it on. Is that helpful for the moment?
Yeah, no, that's very thorough answer. Thank you.
No problem. I could still lecture for England on why you need your vaccines. And I think important also when you're talking to people, we're not just thinking COVID. Please get your flu vaccine. We want people to get flu vaccines for children as well. I've just saw a report yesterday. I believe there's been some misinformation in the media about the nasal flu vaccine potentially making kids more vulnerable to group A strep. There is a health protection agency, an UXA report just published, very, very clear. Kids who get the nasal flu vaccine are reducing their chances of getting group A strep. So if it's a good thing that parents can do, because kids will be more vulnerable to group A strep if they've had a viral infection like flu, and then they get that bacterial infection on the top of it. So, if we could encourage parents to get their kids the nasal spray, that would be brilliant. Any more vaccine lectures? I don't think so. And any more questions, Tracy?
I can't see any. There are none in the comments. I can actually see the comments box now, and a few people might be surprised to see I've made you co-hosts, and that's just so that you can let people in the waiting room when my screen goes blank. Thank you.
Right,
thank
yeah.
you
So nobody else wants to invite a lecture about vaccines. That's fine. Okay, thank you.
Thank you. I think we've got Emma next, who's going to tell us about Winter Wellness campaign. So I'll share my screen again.
Thank you. So it's just a reminder that our Winter Wellness webpage, there's the address for it. So you can go on and see tips and advice on how to keep yourself well and how to keep yourself warm as well. This month we are focusing on how to look after your mental health. So that is also on the webpage. So we talk about how you can get support, and another thing we focus on is our 5 ways to well-being, which is a nice little read if you want to go on and have a look. And if you go to the next slide, please. And these are just the graphics that we'll be using this this month. So we've done a bit of a Christmassy theme, bit of a festive theme. So you'll see that on billboards and on our social and things like that. Thank you.
Thank you very much, Emma. And I had a message this morning that one of our colleagues from Turning Point wasn't going to be available because she was poorly, so I very quickly put this together, but we have got somebody actually. But I'll keep this slide in because it just gives a link to the adult mental health support page, and there's also a link for urgent support if you need suicide prevention advice or information, so those will go out in the slides. And I was also asked to share an email which had got some information, these 2 documents, so they will come out with you separately after the meeting as well. So I think we've got someone from the NHS giving us an update about winter vaccinations, and then we'll come back to Turning Point, if that's okay.
Thank you, Tracy. I'm Sharon Thatcher. I'm project manager for Wakefield Place, and I support Sarah, who is unfortunately on a winter vaccination board meeting today. So Sarah has put this slide deck together for us today, and if you can go to the next slide, it tells you how we've done in Wakefield in terms of the autumn booster programme. You can see the graphics on the right are the best to look at. So the block of green there, we are 115,933 doses in Wakefield we've done. We've had a good performance in Wakefield. It's over the West Yorkshire average. So we're a little bit ahead of all our colleagues in Leeds and Bradford and Calderdale and Kirklees, which we're quite proud of. It does vary, and we do have people, as you can see that red block second up from the bottom, we have got a lot of people that are eligible that haven't come forward there for their boosters. I think we've performed quite well at the eligible, the more priority cohorts, but as we've gone down to the 55 to 64 cohorts, we're not getting so much uptake, although we've got a lot of vaccine apathy in that age group there. So, but we've still got vaccines available until the end of, well, I think sometime in February we've been told we can vaccinate till. So we have a mop-up programme, mop-up arrangements in Wakefield now, going forward from January. We've got availability throughout Christmas, apart from Christmas Day, Boxing Day, and the 1st and 2nd of January. People in Wakefield will be able to get their boosters. They can book on the National Booking Service, or we've got grab a jab opportunities as well, where people can just walk into a centre. So hopefully we'll see numbers continue, but we're way short of our regular 2,000 per day we've been doing at the start of the take-up. We've also done very well with flu as well, a little bit more flu that we've given out than we've given for COVID, so that's quite good there. And as you can see, we're still doing evergreen doses where people are coming forward, encouraged by the messages, the communications going out there. People are still coming forward now with their doses, perhaps because of the message that they're hearing on the media about the pressures in hospitals, that people are still getting seriously ill, albeit it may not be from COVID, it may be from other respiratory illness. It's driving people to take up their primary doses. And if you want to go on to the next slide. I think we have a breakdown there of the, yeah, so our most eligible, our most priority cohorts, the people more at risk of being seriously ill if they do get COVID. As you can see, we've performed a lot better there. The care homes, the PCNs have done a really good job of getting across to their care home population, getting their residents vaccinated. We've had good uptake of those higher priorities there. But you can see as we come down the priority order cohorts, you can see that the levels are getting less there, which is why we're still providing all from there. Yeah, so the mop-up activity, we have got a massive decrease across West Yorkshire in take-up of vaccines at the moment. As a result of that, we have lost 2 of our larger centres, with the vaccine centre in Wakefield is closing on the 30th of December. That is really, there's just not the demand there to keep the staff available, and the staff who are all employed by Mid Yorkshire hospitals are being put to use in the hospitals there. So I think that's perhaps a good move. Pontefract Squash Club was a commercial decision by the community pharmacists that, again, the numbers were dropping such that they couldn't keep that going. It wasn't commercially viable for them. But we do still have coverage in Pontefract at Medichem, which is literally just across the road from the Squash Club. Flu and COVID vaccinations are still available through our community pharmacists. And as I say, we have got appointments available into the new year. And then on every single day, we've got those going. And so we're delivering boosters, primary doses, and children's primary booster doses as well, up until the mid-February, I think it is. We're still waiting for clarification on exactly when the programme will finish. And the primary care networks are still, you can see we work 100% on our care home residents or our over 75. So the primary care networks are still making sessions available to try and pick up those that are perhaps not due for their booster until more recent. So that activity is still going on there.
Oh, sorry. I think, was that your last one, Sharon?
Yeah, I hope so, because I don't know anything about what's happening with long COVID.
Sorry about that. I've just noticed that Claire's got a hand up. I don't know if Claire, have you got a question for Sharon?
Hi, Claire.
No, it was just a very quick comment around what you said about we've done better with the COVID boosters than the flu vaccines. I think just that underlines for me the importance of what I was saying earlier, that we've got a fair bit of COVID around. We've also got a lot of flu around. So actually, if people can take the opportunity to really push the flu vaccine message, because it's still not too late to get one, that would be fantastic. Thank you.
Yeah, fortunately, a lot of the community pharmacists in Wakefield are doing co-administration. That's quite good. The vaccine centre, when they didn't have flu, they had regularly availability where people could go and get flu, because quite a lot of people would ask that question when they were coming for the COVID, where can I get my flu jab? Am I not getting my flu then? Type of thing. So they each week had where people could signpost people to where they could get their flu vaccine.
Yes, but it's just more difficult if you have to go to two places, isn't it?
Yeah.
But just if we can keep encouraging both adults and kids to get theirs done, that would be fab.
I'm sure our COVID champions will share that message. Thank you very much, Claire. Any more questions for Sharon? I can't see anything in the chat, so I'll move on. This is a request from a colleague of mine, Lisa Chandler, who was working on post-COVID syndrome, and she's advised that there are quite a bit of support available for people living with long COVID, but the worry is that those who need it might not be coming forward from some sections of our community. So there is a very small pot of funding available for projects to help raise awareness and encourage people to come and get help for the symptoms, and also to work with existing services. So if you've got any ideas on how Lisa can engage with those people and try and make the project open to more to come forward, please could you contact Lisa on that email address. I've just got one slide and then I can stop sharing and pass on. But thank you to one of our COVID champions, Pam, who's not here today. She sent her apologies. She asked if people could have thermometers, and I know, Claire, you said that you would try your best to sort that. So I know yourself and Ben have worked hard and we've got a supply. So if any of our COVID champions would like a supply, please email us, give us your name, your address, a rough idea of what quantity. We've not got thousands, but just a rough idea of how many you need and we'll send them. So I think that's it for my presentations. We've got a Turning Point who are going to, I think you've got a presentation to share, and we've also got Jez who's going to help to share some messages about mental health, and then finish with Ben. I'm not sure, Ben, did you send me a slide? I'm not sure if you did. No, that's fine. So can we have Turning Point next, please?
Yeah, just one moment, Tracy. I'll just try and share this slide.
Thank you. You'll do a much better job than I did. I've excelled myself this week.
Can you see this slide? The Turning Point slide?
Not yet.
Because I have shared screen.
I can just see you, Satinder.
Okay.
I'll put multiple participants can share the slides simultaneously. See if that works.
Can you see it now? Is the slide visible now?
No.
Oh, I have. This is really weird because I did say share screen.
If we can't get it up, I suppose we can talk. Oh, hold on.
I think now.
Yep.
Thank
We're
you.
there.
It's Zoom is so different
It is.
to Teams.
Nightmare.
That's why. So, hello everybody. My name is Satinder, and I'm the team leader, like I said, for the Wakefield and Southeast teams. And joining me in a bit, Bev Rankin. She's team leader of the Young Persons and Families team. So Turning Point, we are a specialist provider of substance misuse, mental health and learning disability service. Bev and myself, we are from the specialist substance misuse team. And we employ over 4,500 people, and we have 300 locations all across England. So 93% of our services are CQC rated as good or outstanding. And in April of this year, we had over 13,000 people in structured drug and alcohol treatment. And we have a long established relationship with Wakefield, and we've been delivering services in the area for over 35 years. And we work with multiple stakeholders. Locations wise, so our main hub is at Radcliffe House, which is in Wakefield City Centre, and this is the adult substance misuse team. And we have another hub at Wesley Street in Castleford, and that's also an adult service. We have a hub in Cross Street, which is also Wakefield City Centre, and this is the Young Persons and Families and Carers Service hub. We have a criminal justice service based at Bellevue Business Park, and we have our community support hub called Social Issues, which is also on the Bull Ring. So the next slide, it just gives a bit of information, just a brief overview about our models of delivery. So, which means what are the pathways or the means that we apply to treat people who come into our service. Clinical interventions, which means that some of our clients who use opiate-based substances, they could possibly be put on prescriptions, and prescriptions would be to substitute the opiate use. So we would have clinical interventions for that, and also for our alcohol target team. We often have clinical pilots and pathways. We have our wellbeing assessment team. We have qualified nurses on site. We also offer either a community detox service or inpatient and residential detox and rehabs. We have MOPSI group programs. So MOPSI stands for Models of Psychosocial Interventions. These can be done online or face-to-face, and this is mostly to address the psychological reasons of drug use, or the psychological benefits of taking part in group work. We have a specialist alcohol target team. We also have a shared care provision where we have our colleagues who work out of GP surgeries. We have our criminal justice team has specialist offenders program. So we work with people who are released from custody, you know, if that is prison, or that could also be from courts. Some of our clients do come from secure mental health units as well, and we work with them to address their drug use as well as the offending. We have some specialist posts within the service. We have a housing specialist whose job is to signpost and advocate for our clients who are NFA or homeless. We have a long-term conditions worker. Long-term conditions worker works quite a lot in an outreach manner, visiting clients or working with clients who have other long-term conditions, could be caused due to the drug or alcohol use or unrelated. We have an isolated communities worker as well. And we have a needle exchange and pharmacy liaison worker. She runs the Sharon Steele. She runs the needle exchange in our hubs, and also coordinates with all the pharmacies that we work with. We have enhanced outreach and community development models. We also have in the families and carers hub, we have a 5-step intervention and resilience building. Sorry, I'm just gobbling my words at the moment. And I think Bev will take you through the next few slides. Over to you,
Hi.
Bev.
Thank you, Satinder. So I'm Bev Rankin, and I manage the adult treatment team at Castleford, but I also manage the young persons, young adults and families and carers, which is what I'm going to talk about now. So our team for the young persons and young adults provision comprises of 3 specialist recovery workers. So we launched in July 2020, so right in the middle of the pandemic, which wasn't the best time to launch a young person's service because all the schools were closed. So that had its difficulties, but we've plodded on. So we've worked really hard to get pathways in place with our key partners. So we work with CAMS, which is Community Adolescent Mental Health Services. We have links with the youth offending team, with teams around the families, teams around the schools, lots of work with social care and safeguarding leads at schools. So as a team, we'll offer support and training to schools and colleges. We'll offer training to other professionals. We deliver an outreach provision mainly for the young people. So we'll work in community hubs in the schools. We'll go to their homes. We'll go to pupil referral units, colleges, anywhere that the young person feels comfortable to be seen. They can also be seen at our hub if that's what they wish. So we do one-to-one support or group work. We always have a harm reduction ethos, and we'll offer Reclaim, which is kind of 1 to 6 sessions of psychosocial interventions that were specifically designed for young people. And it's evidence-based, and it sort of comes from motivational interviewing and CBT. I think Satinder mentioned before the hidden harm work. So basically we'll work with young children from any age really, where we know they can understand after assessment. That's usually being about 7 years old up to 18. And we work with those young people basically if they've been affected by the parents' substance misuse. So we'll look at the impact of that. We'll try to build some resilience with these young children and do some safety planning with them. Excuse me, I'm getting that cold everybody's getting, unfortunately. We also have access to specialist prescribing if that's needed, and we can link in with our adult teams where we've got clinical staff. If there was a prescribing need for a young person, they would always be seen out of the adult service, and we keep them very separate and keep them linked into the young person's young adult service. So we'll also support those individuals to successfully transition, if needed, between young persons and young adult service. So that's up to 25. So we'll keep them just before the 25th birthday. If they wish to go to an adult service or need to go to an adult service, that would be done on a case-by-case basis. If we felt they were vulnerable young adults, we'd keep them within the young person's service for as long as we could. All our young persons workers are Thrive trained. So initially, Thrive was conceived as a way of tackling the issue of school exclusions, but it's now a whole setting approach, and it supports young people and young adults at the right time with regards to social and emotional development of all the children and young people. Thank you. Next slide, please. So attached to the young persons Inspiring Future services, our family and carers service. So we have 2 workers, and they provide home-based or in-based family support. They work with families with multiple complex needs in order to make those families stronger and safer, and that life's more fulfilling for them, the families and the carers. We can access Family Line, and that's a free helpline that offers befriending and counselling support from 9 till 9 if we're not around, and a text crisis line that's out of hours, and this will be given to all family and carers that are referred to the service. We offer a 5-step programme, and that's a structured evidence-based brief intervention for family members that are affected by a relative's drug use. We can do that as a one-to-one intervention or a group intervention. It works really well within a group. And what we've seen from starting the 5-step group is that the participants in that group have gone on to set up their own support group, which is really good. So they've all kept in touch after that group for us has ended. So we'll place the family obviously at the core of everything that we're doing. They have task-centred and detailed action plans so they can understand. We try and educate them around why that young person or their family member, whoever it may be, are using substances, and how they can kind of tailor it to their family circumstances. And we would always prioritise the safety and well-being of children and young people. Next one, please. I think it's me still. Yeah. So we're very, very lucky as a service to have a CAMS nurse practitioner seconded into our team. So she works with us 18.5 hours per week, and she will support our young people who have low-level mental health issues. So she'll outreach to them. They can come into the service to see her. The mainly low-level interventions around emotional well-being, emotional regulation, anger management, anything really that young person needs. And she works with those up to the age of 18. Because CAMS then don't work with young adults, we have a pathway for consultation to a dual diagnosis nurse consultant that's attached to the adult team, so that kind of support wouldn't just end for our young people. And then I think it's back to you, Satinder. You're on mute.
Yeah, I just realised that. Just to give a brief overview of the multi-agency working that we do. Like I said earlier, we have delivered services in Wakefield for over 35 years. We are committed, very committed to partnership working. In fact, partnership working is, at the core of how we work. Clear pathways with partner agencies. We do attend multi-agency meetings on behalf of our clients or regarding our clients. Delivery of training to partner agencies, which means that we are able to deliver any information giving session or training that yourselves or anybody else might need. So this could be online, or we have delivered some training face-to-face as well, off-site. So if that is something that would interest any of you, please do reach out and we can sort something out. Coordinated joint care planning or signposting where appropriate. And then we also refer to family and carers provision where identified. So this is what Bev just spoke about. So we are able to refer people who either care for or are affected by substance misuse of our clients. What's the next? So contact information. 0300 123 1912 is a number that you can call us on. You can speak to, so you can choose option 3, I think it is, where you can make a professional referral. People can also self-refer into the service, or professionals can refer themselves, their clients on the website too. And are there any questions, please?
Thank you. Yeah, Jez has got his hand up.
Thanks, Satinder and Beth, for that great presentation. You mentioned about the training there, Satinder, and I'm aware that Turning Point Inspiring Recovery are delivering a number of sessions through Eventbrite.
That's correct.
Which is a really good way that partners can find out more about what the service is offering and what it delivers, and some of the different elements of substance misuse that you work with. So I'm just wondering whether it might be helpful for Tracy to circulate a link for those Eventbrite sessions that she can cascade out to partners, and then have an opportunity to book onto those sessions.
Yes, of course. Yes, I can share that with Tracy. Thank you.
Thanks,
Thank
Jez.
you.
Fabulous. Yeah, thank you. If you email that across to me, we'll make sure it goes out with the after meeting information.
I will,
Thank you
Tracy.
very much. I can't see any comments in the chat, and I can't actually see anybody's hand up. But I am conscious, Jez, that I invited you along as well because you and I work in the same team in public health, and you have lots of information about suicide prevention and things like that. I wondered if you've got a few words that you'd like to say, Jez. I'm putting you on the spot a bit.
You are, no, it's absolutely fine. Thanks, Tracy. I think, I mean, I'm happy to come back when we're maybe a bit more time conscious. Ben also has got a slot to fit in. So I guess what I will say is public health don't commission mental health services. And that kind of responsibility sits with Wakefield Health and Care Partnership. Obviously, our role is around prevention and population level health, and we're conscious that mental health has a significant impact on a wide range of people. So what we try to do is we're involved in delivering a number of kind of local campaigns with the support of our comms team. That might be a locally developed campaign, or it might be something that it might be a national campaign that we will upweight. Strategically, we try and promote the prevention agenda through things like the Mental Health Alliance and work with those partners on those issues. I guess just a bit of context for us locally is that we are seeing from the data that we have so far is that we are seeing a deterioration in people's general kind of well-being, particularly since the pandemic. We do have higher than average levels of anxiety and depression in the district, and we have the highest rate of suicide in Yorkshire and Humber. And we know that mental health and well-being is a significant factor in suicide. So the public health team do lead on a suicide prevention plan, an action plan, and that's currently been refreshed. And we're currently doing an audit of suicides over the last 3 years, working with the coroner's office. And I think just finally, because I know I haven't got much time, but just to say really, obviously, these are really difficult times for people. We are, from an economic perspective, it's quite a challenging time for many people. And again, we know that that can be a determinant of poor mental health. And certainly historically, we see suicide rates increase following periods of economic downturn or recession. So it's a difficult position that we find ourselves both locally and nationally around mental health. So we'll continue to support our colleagues across the CCG and across SWIFT in trying to kind of promote messages around well-being and supporting people's mental health generally. I know that's a real whistle stop, as I said, Tracy. I'm happy to kind of come back and talk in a bit more detail, but I'm just conscious of time. But I'm happy to kind of take any questions on public health's role around mental health or any other issues at all.
Thank you very much. That was really useful. And Jez, I have been circulating information as you've sent it to me about gambling and things like that. So hopefully people will have had that information. I can't see any questions up, so shall we go straight on to Ben? And if we do get any questions, I'll forward them on to you, Jez. Thank you very much.
Thanks, Tracy. Let's see if I can get this on. So I think I've done the presentation explaining the ins and outs of what the healthy housing pathway is many times in this meeting and others, so I'll just keep it to a quick snapshot. So, oh yeah, where are we? So just as a snapshot for anyone who's not aware, the Healthy Housing Pathway was funded after a successful bid to the Winter Warmth Fund earlier this year, I should say. It's a joint venture between Public Health and Strategic Housing, designed to simplify the process for referring those in need of assistance with housing and fuel poverty issues. It's come back. And deliver targeted promotion to partner agencies. We're able to assist private tenants and homeowners with a household income of under 30,000 and savings under 16,000 to access things, assistance from the council with such as insulation and boiler upgrade measures, financial support and guidance, including direct financial relief on priority debts, support to resolve issues with private landlords who aren't maintaining the properties. We've got an emergency heater provision for if people's heating or hot water breaks down, particularly in the winter, and then referrals to other agencies as required. This was set up we launched in July, so I've just got a bit of a 6-month update for everyone. So for the promotion, we've got out to 118 agencies face-to-face, 305 staff seen in person or via Teams, which doesn't include a lot of like the umbrella networks where we've sort of gone in at a higher level and asked people to cascade down through their networks, I guess. We've tried to go heavy with the NHS to help relieve pressure. Obviously, I think that was well documented the difficulties they're having at the moment. So we're trying to assist those guys as much as we can, particularly in these respiratory, primary care, and these children and young people services, etc. We've been out to 19 networking events with Job Centre Plus, Yorkshire Smoke Free, like so many to list. They were just the ones that came to mind when I was knocking this up. It's been rolled out from the Chief Executive of Wakefield Council, the Head of Wakefield Schools, and the Chief Executive of Mid Yorks Hospital Trust. So we feel we've got a good reach, and we've got into the all but one PCN in the district as well, and that one should be ticked off in January next year. So up until the 8th of December so far, we've had 195 referrals generated, and it's broken down roughly 3/4 of those ish have been self-referrals via the website link, which I'm going to share in a moment. Social prescribers have been really good, and we've got more since the 8th. They're absolutely flying in at the moment. And these are just where the other sort of referrals have come from, feeding into that. By month, you can see how it's sort of built up, coming into October, November, December. It really sort of took off, and we're fielding. It's they're absolutely flying. I think since this meeting started, I've had another 5. So yeah, it obviously shows us a demand for the service. Once we've got them, the outcomes have been gone to the energy team for 71 for assistance with boilers and installation measures, Money Smart for the direct financial, not direct, but financial assistance of various sorts. 26 have gone over to WDH because obviously we can't install measures in their properties. 9 to enforcement to deal with landlords and house maintenance and damp in private rented properties. 5 to local welfare provision to get immediate, usually financial relief, or if if they need something there and then. 1 back to live well, and then lost contact 19. And then I've just chucked in a couple of potentially interesting. I know this might be small, but you can zoom in if you. I'll send this round via Tracy afterwards. Nothing too surprising on the sources of where the referrals are coming from in terms of location. Pontefract, Castleford, Normanton, and the sort of that side of the district accounting for most of them, along with Wakefield Central. The EPC ratings of the properties for the people who are applying. You see the big yellow one here, that's D. We've got a sizable, that's the main one, sizable C, E. The non, that tends to be owner occupiers who've owned the houses over 10 years, where they've just not got one. And then you've got A and like that. So you can see there's a lot to do. So the goal is the council are trying to get everybody in every house in the district to a C by 2035. So you can see there we've got a fair old way to go if this is anything to go by. I've put in a few quotes from recipients of the support that we've offered. So you can see, this was the top one was a lady who had her gas boiler replaced after it was condemned. Things are much better since, and we put radiators in that one as well. Things are much better, really good and helpful. fantastic, life-changing. So lots of positive feedback for it. It's making a real difference to people's lives, which is good. That's what we were hoping. Big weight lifted off the shoulders there with the financial assistance and relieving that priority debt. For anyone who's interested in learning more, this is where you can apply and get more information. It's not formatted very well, unfortunately, but if you go to the Wakefield Council website and the housing section, you'll see the healthy housing tab there, and you can apply. You can apply there, see all the information and what we do from there, and a QR code if you're that way inclined. And where are we? Oh, and yeah, I just thought I'd put this one at the end, just for anyone who's having conversations with like face to face with any clients. So this gentleman is a reporter or journalist from the BBC, and he did an experiment to see what would happen to his body physiologically if he was subjected to just being at 10-degree temperature just for half an hour. So you can see that obviously the blood flow to his brain fell by 20%. His breathing, respiratory rate went up, heart rate went up, extremities dropped temperature by 2 degrees, and it affected his cognition by quite a significant margin there. So, and that was just a healthy chap for half an hour at 10 degrees. So if you imagine if someone's sitting in that day after day, what effect, these impacts are potentially going to be multiplied and cause a lot of problems, just through the nature of putting pressure on the body. So I just thought I'd put that in there, a bit of an interesting thing I saw last couple of weeks ago. And yeah, that's it. So thank you. If anyone's got any questions, I'll take them. And if not, I'll send it round and make sure everyone gets that. Thank you.
Thank you very much, Ben. And that picture at the end was really useful, actually, to show what effect being cold does have on your body. And that's why in some instances it's important for people to have those little thermometers which say which a safe zone is to keep warm, particularly for older people and younger ones as well. I can't see anything in the chat. Let's have a look. We've had a few people saying that they've had to leave, but thank you very much. I can't see anybody's hands up. No. I just want to check, has everybody spoken that was going to speak? Because it's been a tossed salad today, hasn't it? I've thrown everything in all out of sequence, but you've shared some really useful information. Thank you ever so much to all of our speakers and to the champions for coming and listening and sharing that information. Thank you, everybody. So if we've no more questions, all I need to say then is I hope you all have a really happy Christmas, prosperous New Year, and for those not celebrating Christmas, I hope you have a wonderful time off work. Thank you ever so much, everybody.
Thank you.
Thank you. Have a good Christmas, everyone.
Thank you.
Bye-bye.
See you guys. Bye-bye.